HESI Exit Medical Surgical Nursing, Mastering the Cardiovascular System. Introduction. Welcome to our comprehensive review of the cardiovascular system for the HESI Exit exam. In this video, we'll explore understanding cardiovascular anatomy, physiology, and key conditions identifying common cardiac disorders and interventions. Applying critical thinking for safe patient care. The cardiovascular system is crucial in nursing practice because cardiovascular diseases are leading causes of morbidity and mortality. Nurses play a crucial role in prevention, early detection, and management. Heart anatomy and function. Let's start with the foundation, the heart structure and function. Heart structure. 4 chambers, right and left atria, right and left ventricles. 4 valves, tricuspid, pulmonary, mitral, and aortic. Heart function. Blood flows through systemic and pulmonary circulation. The myocardium pumps both oxygenated and deoxygenated blood throughout the body. Cardiac cycle and electrical system. Understanding the cardiac cycle is essential. Phases of the cardiac cycle. Systole, the contraction phase. Diastole, the relaxation and filling phase. Electrical conduction pathway. SA node acts as the pacemaker. Impulse travels to AV node, then bundle of His, then Purkinje fibers. Clinical significance. Disruptions in conduction lead to dysrhythmias like atrial fibrillation and ventricular tachycardia. Key diagnostic tests. Several tests help us assess cardiovascular health. Electrocardiogram ECG/EKG detects dysrhythmias, ischemia, and infarction. Echocardiogram evaluates cardiac function, valve disease, and ejection fraction. Cardiac catheterization assesses coronary artery blockages. Stress test evaluates cardiac response to exercise or stress. Important blood tests. Troponin and CKMB indicate cardiac muscle damage. BNP, marker for heart failure. Lipid panel measures cholesterol levels. Hypertension, the silent killer. Hypertension is defined as blood pressure greater than or equal to 130/80 mmHg. Risk factors include smoking and obesity, high sodium intake and sedentary lifestyle, genetic predisposition, serious complications, stroke and myocardial infarction, kidney damage. Nursing interventions focus on lifestyle modifications including diet, weight loss, and exercise. Medication management with ACE inhibitors, beta blockers, and diuretics. Coronary artery disease and angina. Coronary artery disease results from atherosclerosis leading to reduced blood flow. Types of angina. Stable angina, predictable chest pain with exertion. Unstable angina, unpredictable pain with high risk for heart attack. Prinzmetal's angina, caused by spasm of coronary arteries. Treatment options include medications such as nitrates, statins, and beta blockers. Procedures like PCI and CABG for severe cases. Myocardial infarction, heart attack emergency. A heart attack occurs when there's complete occlusion of a coronary artery, leading to ischemia and tissue death. Classic symptoms. Crushing chest pain that may radiate to jaw or arm. Diaphoresis, nausea, difficulty breathing, and anxiety. Emergency nursing actions follow the MONA protocol. Morphine for pain relief. Oxygen to increase oxygen delivery. Nitroglycerin for vasodilation. Aspirin as an antiplatelet agent. Long-term management includes cardiac rehabilitation programs, smoking cessation and medication adherence. Heart failure management. Heart failure has 2 main types. Left-sided heart failure results in pulmonary congestion. Symptoms include difficulty breathing, lung crackles, and orthopnea. Right-sided heart failure. Causes peripheral edema, jugular vein distension, and liver enlargement. Management strategies. Medications including diuretics, ACE inhibitors, beta blockers, and digoxin. Low-sodium diet, daily weight monitoring, and fluid restriction. Additional cardiovascular conditions. Valvular heart disease. Common disorders include mitral and aortic stenosis, regurgitation, and prolapse. Symptoms are murmurs, fatigue, fainting, and difficulty breathing. Treatment involves valve repair or replacement. Peripheral vascular disease. Arterial disease causes leg pain with walking, weak pulses, and cold limbs. Venous disease results in swelling, varicose veins, and leg ulcers. Deep vein thrombosis and pulmonary embolism. DVT signs include unilateral leg swelling, warmth, and pain. PE signs are sudden shortness of breath, chest pain, and rapid heart rate. Treatment includes blood thinners and early movement. Critical cardiac emergencies. Atrial fibrillation. Increases risk of stroke, heart failure, and blood clots. Management includes anticoagulants and heart rate control medications. Cardiogenic shock. Heart pump failure leads to poor organ perfusion. Symptoms include low blood pressure, weak pulses, and cold extremities. Treatment involves oxygen, for fluids, and medications like dopamine. Cardiovascular pharmacology. Key medications you need to know. Antihypertensives, ACE inhibitors and beta blockers. Antianginals, nitroglycerin for chest pain. Anticoagulants, heparin and warfarin for clot prevention. Diuretics, furosemide and spironolactone for fluid management. Cardiac glycosides, digoxin for heart failure. Lifestyle modifications. Supporting patients in making healthy changes. Diet, low sodium, high fiber, heart-healthy fats. Exercise, 30 minutes per day, 5 days per week. Smoking and alcohol cessation. Stress management and treatment compliance. You've now mastered the essential cardiovascular concepts for the HESI exit exam. Remember that early recognition and intervention are crucial in cardiovascular emergencies. As nurses, we play a vital role in patient education, medication management, and preventing complications. Keep practicing these concepts, and you'll be well prepared for success on your HESI exit exam. Good luck with your studies!